Okay, we are live. Thank you.
Good evening, everyone. This is the regularly scheduled Public Safety Committee meeting, Monday, July 20th at 5:30 p.m. And we're going to call to order the meeting. And first up on the agenda is the approval of the last meeting minutes on June 15th. Do I have a motion?
Motion to approve.
Second. Second. All in favor? Aye.
Aye.
Thank you. Approved. Meeting is open to the public. This portion of the meeting is specifically set aside for comments from the public who are asked to limit their comments to 2 minutes. Any person interested in providing public comment should email publicmeetings@rockyhillct.gov. You will be provided with a link to attend the Zoom remote meeting and instructions on how you will participate. Do we have anybody in queue? We do have questions emailed in prior to the meeting, so I'll begin reading those in. As with the last several public safety meetings, we are moving to our guest, no longer a guest, a standing member of the public safety, Charles, from the Connecticut Central Health District, Charlie Brown. And as per the last meeting, these questions are for you, Charlie. So I'm going to read them one at a time, but there's 3 questions. Questions are from Krista Mariner. Krista is a town resident at 58 Farms Village Road in Rocky Hill, Connecticut. Krista writes, first question. Is there any way to recommend or mandate COVID testing for frontline healthcare professionals? I've seen multiple doctors. I've asked them if they have been tested. The response is generally no. Why should I get tested? I don't have any symptoms. For me, the mindset of only getting tested when one has symptoms went out the door when it was discovered that asymptomatic spread was a significant factor in transmission. Part 1 of that question. Part 2 of it, dental practices have recently reopened in Connecticut. I asked my dental hygienist if she had been tested. She said, no, I don't have symptoms, plus it's not required. I had far longer than 15 minutes of close contact with her without my wearing a mask. I would think, at the very least, the Connecticut Dental Association would recommend regular testing of dental professionals. I should feel safest at the doctor's office. Instead, I feel the most vulnerable. Question to you, Charlie.
Well, as far as testing is concerned, I mean, we're still having some issues with the test medium and things of that nature. Different healthcare providers actually do mandate their employees to have it, but it's not a state mandate as far as that's concerned. They haven't done that. And that's really where this type of regulation would have to come down from the state as a whole. Department of Public Health, they have issued guidance on when folks should be tested. And there is some guidelines along those lines that people and providers would follow. Dental providers, as well, as you mentioned, they're just recently gotten back into swing as a whole. And a lot of the protection that they have is in the personal protective equipment that they utilize. So, for example, hygienists would have an N95 mask, would have a face shield, gloves, and gown to fully protect, and that's really protecting them and you. Remember, I wear my mask for you, you wear your mask for me. So in that situation where you're unable to wear a mask, that's why they're actually wearing a mask, is to protect you from anything along those lines.
Thank you, Charlie. I believe there's probably state organization that they could, that any resident could make a phone-in complaint or a phone-in question on a medical provider office if they felt necessary.
Yeah, if they felt necessary or felt that somebody was doing something inappropriate, the Connecticut Department of Public Health has what they call the Facilities Licensing Investigative section, and they follow up on all complaints for licensed healthcare professionals.
Thank you. And I will note that this is one person's question in that realm, and I have been to a number of facilities myself, have talked with others. I just don't want the public at large to think that medical professionals are ignoring their own rules. I find most of the interactions I've had to be, hypersensitive and very, very diligent in practice. So that being said, question number 2, Charlie, from the same person, how to enforce the wearing of masks, particularly amongst the younger age groups. I've received reports of people going to grocery stores such as Stop and Shop and encountering customers without masks, or even in my neighborhood when people go out on their daily walks, no one is wearing masks. And before you answer that, I do walk every morning and every evening about a 3-mile loop on sidewalk in center of town. I do not wear a mask because I'm outdoors and I'm not near anybody, and most people coming, we don't walk together, and when we're passing each other, everybody steps off the sidewalk with their dog or whatever, and we go past each other. So I found that works quite well, and that and that's what I do.
Yeah, and generally, if you're outside and you're passing someone on a trail or something along those lines, it's not considered significant contact. And you have to remember that significant contact is within 6 feet for 10 to 15 minutes, and that's what really raises that level of potential infection. So if you're passing someone quickly on the trail, separate, as you mentioned, and then also have your mask with you. So that if you do happen to stop and have a longer conversation or have to have an interaction with someone along those lines, that's always a good thing, is to have that mask with you so that you're prepared to be able to be safe around in your environment, even if you didn't plan to have those interactions. Now, the first part of the question related to the younger generation and people within businesses. Now, we've really asked our businesses to step up. To help the governor to enforce this mask mandate that's out there. And for the most part, I think that we have seen a large part of Connecticut has actually done so. We see very few people out there without masks. And remember, not everybody can wear a mask. There are some people who, because they may have asthma, may have other medical conditions, that would preclude them from wearing a mask. So just because you see somebody in a business and they're not wearing a mask, it doesn't mean that they're flouting the law necessarily. Okay. Now, younger people, what we have tried to do as we get complaints of this nature, first and foremost, we educate the business to say, it is your responsibility to do this. And this is almost like the no shoes, no shirt, no service rule. Add no mask to that. So it is their right as a private business to be able to deny service if they're not meeting that obligation. So we remind them of that, remind them that they're protecting their staff and the rest of their customers. And, hopefully through the education, people are understanding the real reason for wearing a mask. I wear my mask to protect you. You wear your mask to protect me.
Does anybody else want to respond to that? It's a general question at large, your interactions around town, Councilor Emanuel or Councilor Punkage?
No, I adhere to that rule. I don't walk into any retail facility or restaurant without a mask. I just think it's good practice.
Yeah, I would.
I'm sorry, Punkage?
No, I'm going to just wholeheartedly support that notion that you are protecting just not yourself, you're protecting others from getting this terrible infection. So I think it's incumbent upon, just as a good citizen, to wear a mask, I think. Yeah, pretty much.
Chiefs, in your interactions out there on the street, and Joe with ambulance, I mean, most people have a mask on them out in public. You know, sometimes we carry, if we're fortunate, I carry an extra one because you're right. You have these unexpected encounters where you have to engage and maybe stay and talk to somebody. Have that extra mask. I don't know. Are you finding that people are unprepared to have a conversation with you when you're out doing your job?
Not too much. Mostly in the convenience stores personally, but as far as with the ambulance services, pretty much everybody has approached us with masks on. If not, we give them a mask. And obviously my crew is all masked up, and along with all the patients automatically get a mask. So overall, people have been pretty good, but I have noticed that personally in the convenience stores, gas stations, people just jumping out of the car, running in for something. And everybody does that 10 steps away from the car and then look at the disgust on their face. I forgot my mask. So we've all done it. But
and remember, let's not let the perfect be the enemy of the good.
Yes.
I mean, that's really one of the things that we really need to remind ourselves. We're doing the best that we can. Wearing a mask is something that we should become a habit. And I think that it is becoming a habit more so now than ever before. So, you know, it is something that I think you're seeing more often. And hopefully, you know, once again, I've said hygienic fatigue is going to set in eventually, that people get tired of wearing this mask. When it's 98 degrees outside and you're sweating, wearing a mask is a difficult thing to do. But, you know, once again, the reason for this is to protect yourself, your family, and your community.
Right. And one thing I'll just add there, New York Times a couple of days ago, I think, had a really nice visual of around the country what the mass usage looks like on an aggregate level. I would encourage all of you, I don't have the link in front of me, but it was a couple of days ago, I think. And it's a digital medium, so you can go and like click on your own area. And I did that. I think it said, if I remember correctly, 87, 88% of the people were wearing masks most of the time. And like there was like 5-6% who were wearing it some of the time, like, you know, and so, you know, it's pretty good coverage, like, and I think that's the kind of coverage we need, and everybody did their part. I think we'll be in a good place.
Mm-hmm.
Third question, hair salon is ranked 7th. Is it okay to ask your stylist prior to making an appointment if they have been tested for COVID? My understanding is that such conversations are occurring in New York City. They should occur in Connecticut too.
Yeah, I mean, I think that as a patron of any particular private business, you know, it's up to you to protect yourself as far as that's concerned. So, I mean, asking them if they've been tested is definitely within your rights. Whether or not they provide you with that information is up to them. They're not required to do so. But, you know, once again, you know, trying to be able to assure that people are wearing masks in those interactions, those personal types of interactions, is important as well. So even if they're not tested, are they wearing the appropriate PPE, the personal protective equipment? Or, you know, do they have the proper safeguards in place to be able to perform the service that you're asking them to perform? That's a very important thing as well. And remember, you know, right now there's a big, I think, push to allow people to do things that are normal, and we're still not normal. You know, once again, we're still living with this pandemic without a vaccine, without a real treatment. So we've been able to get around some things, but we still need to remind ourselves that we're not in a normal situation. So if something is essential and you need to have it happen, doing it in the most safe way that you can is what you need to do. As you can tell, it's been a while since I've had my beard trimmed, because that's not a service that they can actually perform. So, you know, it's a reminder of that essential service, that want instead of a need.
Thank you. That's the end of the questions. Charlie, do you have a report that you can give us quickly?
Yeah, as of yesterday, Rocky Hill had a total number of cases was 426. Total number of deaths was 93. So it's actually gotten a little bit better from the height that we had seen earlier. So things have slowed down quite a bit. You know, what we're seeing now is not a lot of the cases being driven by the nursing homes, and that's where the majority, I think, of the cases for Rocky Hill actually came from. What we're actually seeing is a shift to a younger cohort of people that are becoming infected, and that's the 20 to 29 and 30 to 39-year-old groups. So what we're seeing is, you know, once again, it's additional socialization, it's additional, you know, work because they're being allowed to work, and more personal interactions. So this group, you know, has started to get more of the infections, and this is kind of what we've expected. It's going to be challenging, you know. Right now, Connecticut had a couple weeks ago, we were, as far as our rate of transmission, we were at a 0.71, and as of today, we're at 0.99. So just to remind folks, rate of transmission, if you're at a 1 or above, that means for every person that actually gets this particular disease, they're transmitting it to one additional person. So the higher that number gets, the more people that each individual will actually transmit it to. So when you're under 1, that means that it's the less number that you're actually transmitting to. So it's less than one person. So we're just right on that line right now, and the majority of the states are above that line. Many places south and to the west are like 1.5, 1.7, which is not where you want to be. So just a reminder: follow those 3 W's. So wash your hands, you know, wear your mask, and watch your distance.
So Charlie, the mayor has that flyer going out, the mailer, which in conjunction with your help and CCM on wash your hands, wear your mask,
Watch your distance.
you know, hygiene fatigue,
Yep.
summer mailer. So that did go out. Any questions for Charlie? John, Emmanuel?
Oh, all set. Thank you.
Punkage?
Yeah, so Charlie, I have just one question, and this might be a difficult question because I do understand it's not an easy issue. So I over the last several weeks, I've gotten lots of emails from parents and, you know, just generally like neighbors, and I mean, just people who have school-age children. Let's just say that. And the question for you is, obviously there is a widespread concern about going back to school, and people like me, personally speaking, just for speaking for myself, I'm also kind of in a place where I'm kind of torn between, I want to send my child back to school and he wants to go back to school, but then I'm not sure like what's going to happen once he goes back to school, because then I have a mother-in-law who lives with me, and she's of a certain age, and I want to protect her, right? So I'm sure like this microcosm of my household is pretty much, you know, existent elsewhere as well. So the question I was getting to was, in your professional opinion, right, and as difficult as this question is to answer, what will be your approach if you were in charge of opening up schools in Rocky Hill?
Well, I mean, if I was in charge right now, the safest option, and remember, you're talking to a public health professional, the safest option is virtual. That being said, it's not, from a policy perspective, it's not 100% solution, because people have to work. Kids need that emotional and mental support that schools sometimes provide. So it's not something that you can take a 100% stance on. Let's put it that way. But what we've been trying to do is work with each one of our school districts to provide the safest option as they're planning to go back to school. And I think that a lot of the health districts that we've been, or school districts that we've been working with, have consulted with us on, you know, a myriad of issues on how they cohort in the classrooms, on what their plan is if they were to bring people back, how to do that, appropriate hand washing and things of that nature, to be able to help make the return back to school, if they go back into a physical environment, safer, than it would be without it. So that's one of the things that we want to acknowledge right now, because there's very low levels of transmission within our communities. That may be the opportunity to get kids into the classroom, orient them to where they are. And then as the levels rise, we may have to pull the plug and go back to virtual school. That's where, honestly, I think some of the upper levels of government, as far as the governor and all that, may be actually thinking, is using this time, this lull, to get them oriented and get them ready. And then, okay, if it starts to come back up, go back to virtual so that we can protect everybody in the community. That's my thought on this. I'm not sure if that's actually going to come to pass, but we still have a great working relationship with Mark Zito and the schools, to where they can call us with any type of issue whatsoever, and they do. We've got a good relationship, and what we're actually getting ready to do is, this particular pathogen, everybody compares it to flu. It's not flu. It's different. So we have to really look at each situation a little bit differently. So we can't use some of the models that we've used in the past. For example, closing down schools. We don't have an algorithm that says when we reach this particular threshold, this is what we should do to be able to close down schools. It's a very individual approach because it does depend upon how good the schools have done in cohorting their classrooms. So we have to do that contact tracing once we have somebody that's positive within that school setting. And if they can do that effectively, then we don't need to shut down the school. We can maybe send a classroom home for 2 weeks. And then when they come back, they can come back into the school. So it's being flexible and having the relationship with the school systems that will allow the schools to be open for as long as we can keep them open. I hope that answered your question.
No, it did. It did. No, thank you. I think this is an important question. It's top of the mind of a lot of people for obvious reasons, and there's no easy answers yet. I understand that, but I wanted to get a professional opinion on that because
like I said, honestly, if it was up to me, I think virtual would be the way that we go. But there's a lot of things that are involved in that. It's a very political decision, and there's a lot of other factors that play in. From a health perspective, the minimal personal interaction, virtual is the best.
Thank you, Charlie.
Thanks. Charlie, if you do need to log off, feel free to. We've got to move on and get fire and police in here with the remaining 15 minutes. So Chief Garahy.
I'm gonna go ahead and bow out then. Bye, y'all.
By all means, thank you. Chief Garahy.
Yeah, I was just unmuting myself there. The reports in the monthly package, you'll have our run reports and the fire marshal's report. Last month, we responded to 37 calls for a total of 359. And last month, I said that was on the low end of normal. This month, we've seen a considerable spike, and we're at about 50% higher than that with about 10 days to go. We recorded 502 training hours, 1 minor injury, year to date 1 on that, and pretty happy with those numbers. Our staffing down just a couple. We had 1 resignation. We're at 68 active and still able to handle all our calls. We just started recruiting again as we were able to come up with a solution through our medical provider for pre-employment physicals. A couple other real quick updates. Our COVID administrative directive has been revised, to reflect the governor's post-travel executive orders. It also reflects our return to weekly training with safety provisions for the training grounds as well as the classroom areas. We have reinstated our yearly physical exam process for membership, and triggered from the physical exam is our annual CBA fit testing, which is required for each interior certified firefighter. We have begun training on our new accountability enhancement system, which communicates through an activated air pack to a receiver, then onto a computer for us to view and monitor. Accountability is the program to track firefighters at any time within emergency situation. But since all emergency scenes don't require air packs, we have a process to track members while working in all areas of the emergency scene. We hope to have this fully operational with our training complete by the first of the year. My last update will be about our PFAS-free foam system, and following guidance from the U.S. Fire Administration and FEMA, we're beginning tomorrow night training on our new encapsulant type foam, and we have begun the process to remove the old foam concentrate, which will go into drums for future disposal or donation. The old style foam concentrates have high concentrations of PFAS and some other harmful chemicals, which have been determined to be carcinogens as well as dangerous to the environment. So we feel this is the best direction for us, as well as the community, to remove this, store it for disposal, and go to a new encapsulant type foam. That's pretty much it. If anybody has questions.
Councilor Emmanuel? No questions. Councilor Punkage?
I'm good, thank you.
Oh, no questions?
Questions?
Okay, all righty. Let's see. So I just want to get that straight. What is the incident count, Mike, going up to now?
Ed, we don't have the total for this month yet, but
Yep.
we're seeing a spike in incidents. We're at 259 up to July or June 30th. I'm sorry, but we've seen close to I think 55, 56 so far this month. So we're seeing a spike now.
Gotcha. All right. And those are they actual fires?
We haven't had structure fires. No, it's a little bit of everything. I can't put my thumb on one particular category that you see driving up. We'll have a better analysis this time next month, as once we get all the data, we break it down by the call categories, and we'll be able to provide you with some better data on that.
And now the real summer heat is here. How about cooling centers and the added exposure with this COVID? Do you have a cooling center? Are we initiating any of that?
Excuse me. That's through emergency management, and I touched base with the fire marshal over the weekend, and there were no plans to do cooling centers, and acquiesced to the town manager, see if he has anything further on that.
This point, with COVID, construction at the community center and the library being closed, we really don't have, and we can't use the schools as well. We really don't have a place for a cooling center unless we actually do lose power in the town, and then we'd implement something perhaps at the firehouses. But basically, due to COVID, construction, and closure of buildings, it's difficult for the town to put cooling center together at the moment.
I'm just wondering if there would need to be any type of intermediate step, like delivery of cold water, or making sure that folks at risk, maybe some of the seniors know that the pool has scheduled hours, that they could get down and get a dip and get back home. I don't know. I mean, the humidity is actually a factor right now, I think. I mean, it's 92, but the humidity is like almost 100%, you know, and I just have to think some folks are really hurting.
Well, they can call 211 for cooling centers in the area.
211?
211 to check.
Thanks.
But generally, I think people are preparing themselves for this heat and so on. It's just a matter of hopefully their equipment doesn't break down.
Yeah, okay, sure. And I'm just thinking hyperventilating with wearing a mask in this type of weather is going to maybe be a little bit more difficult for some folks, you know, with their breathing. So I am cautiously optimistic, I guess, that people aren't going to exert themselves right now and they're going to stay as cool as they can. So, okay, great. If there's no issues on that, moving along to Police Chief Custer.
Okay. Well, again, a couple numbers for the month of June. It's interesting. Chief Garrahy saw a spike in fire calls going up because we actually saw the opposite in terms for calls for service with the police. If you remember last month, we had over 2,900 calls for service, which was the highest point of the year thus far. And we attribute a lot to the weather getting better, people coming back out, etc. The calls for service for June were 2,361, almost 500 calls less. I'm not sure why, but we'll take it. It seems like things are a little bit quieter, at least for the month of June. Criminal arrests were 13 for the month, 25 motor vehicle accidents investigated, 23 infractions issued, 59 warnings issued, and 58 training hours. Training hours are generally low during the summer months because of vacations. So in terms of staffing and our status at this point, we have 3 officers in field training. 1 officer is in phase 2, which means that she should be completing sometime around the end of September if things go well. And then I have an additional 2 other officers who graduated from the academy and have just begun field training. So they're going to be probably not finishing up till the end of October. So that's 3 positions right there. In addition to that, I have a dispatcher who's also in field training, and she is scheduled to be released from that on August 1st. So that'll put me at full staffing with the dispatch crew. We do have 1 officer vacancy presently, but we have made a conditional offer to a certified officer out of the Hartford Police Department. We're doing a background check on him now. So far, so good. I think he has just 1 more test to do. And if it goes well, we're expecting to have him on board in August. So the good news is, on paper, at least, that puts us at full strength. But I do have a retirement coming up September 1st, and we're planning for that as well. The only other staffing report I have is we do have an officer out on administrative leave and 1 other officer on maternity leave scheduled to come back in August. So it's kind of a busy time of year for us with staffing.
Total department head count?
Total department head count at authorized strength would be 51. We're at 50 presently. So not too bad.
And then that 50 gets broken down to how many patrol, how many dispatch?
38 are sworn personnel and the remainder civilian. And then while we're on the staffing report, I'm happy to report we do have no COVID cases. Everyone pretty much is at work. Community service events and nothing to report. Again, we've kind of scaled those back because of COVID. So really the only other thing I have is just that continual update on accreditation. July 31st is actually coming this Friday. So we are scheduled to be on Zoom with the commission Friday afternoon between 1 and 4, at which time at some point, all the departments receiving accreditation are being called. POM will get the call, and we should be formally presented with our accreditation status. So, we're looking forward to that. And, obviously I'll report further next meeting, but that's all I have for now.
Thank you. Questions, John? Councilor Manuel?
All set, Ed. Thanks.
Okay, question, Councilor Prakash.
Thanks, Ed. So, Chief, like you mentioned, like calls for service, and thank you for putting those charts at the back end, because what I'm able to see here, like while you were speaking, was that your calls of service are actually in line with your 2018 numbers, essentially. Right. So they are not like that off. They dip, but they're in line with. So this is one of the things I was looking for, right? Because this gives you more perspective. And so you look at those calls for service numbers, and it doesn't look like there is anything like, it's just like regular up and down, like the swings of the data, essentially, right? Just margin of error stuff. But there's an interesting point here, though, in the larcenies thing, right? Which is in May, right? You actually you went way up, right? From like even 18 and 19 both. Like it's like peaking up there, and then it did come down a little bit, maybe, but there's something to like watch for there. But I don't know why that spiked in the first place, right? So because it is out of the ordinary for the last 2 years, that's why I'm pointing that out.
Well, these charts kind of play nicely into the presentation we're going to be doing, the council meeting. You look at these categories, 2 areas that are up are larcenies and motor vehicle thefts. Everything else is trending downward. So we're going to do a little presentation on that at the council meeting, because that does seem to be the problem area for us in Rocky Hill. Right.
And that's why I'm so happy to see these charts, because that's why like you give it the trend line. And actually I will encourage fire chief, Gary, and if you guys can put together these kind of charts as well, that will actually help us solve, because the earlier conversation Ed and you were having, right, Chief, I think some of that you will be well informed, like if you start looking at your previous last couple of years of data, right? And that will tell you like really is out of ordinary or not, jumping up and down seasonally or whatever that might be.
Yeah, it's really easy to see once you start charting it.
Yeah, once you start charting it, it really does help. And I mean, hopefully it's not too much work. Again, like I always said this from the beginning, I don't want to add a lot of work, but hopefully something like this adds value, right? Eventually and in the long run.
Absolutely.
Thank you.
Thank you. Ambulance, Joe, great.
Yeah, for the month of June, we had 269 calls. Year to date, 2,120. Our active members is still holding fast at 77 people. I had 2 people resign, unfortunately. One is going to become a doctor and the other one is going to paramedic school. But I got 2 new members to replace them, so we're still holding fast at 77. Everybody's healthy and we're doing great.
Again, any questions, Councilor Emmanuel? Councilor Prakash?
No, I don't have any questions at this time. Thank you.
I thank everyone for the report. I don't want to be rushed. I seem to be rushed on all these. We have farmland and open space. So, John, Mayor, any questions, comments? No, we're all good?
No business and nothing for other.
Okay. Do I have a motion to adjourn?
I'll make a motion to adjourn.
Second.
All in favor?
Aye.
Good evening, gents.
See ya.
Thank you. Stay safe.